Welcome back to Chamber Exchange, a TV show, and we want to thank our sponsors that make Chamber Exchange, a TV show, happen. Bank Hometown, their support of the Chamber this past year have been extremely helpful, and we appreciate their stepping forward to make sure that Chamber Exchange, a TV show, happens. I'm thrilled to have with us on this segment Carolyn Jackson, the CEO of Saint Vincent Hospital. And Carolyn has been with us in a few different venues over the course of this COVID-19 crisis, and we would be remiss if we didn't start out with a huge thank you, Carolyn, to you for your leadership and that of the entire Saint Vincent Hospital team. Having you and Dr. Dixon from the UMass Memorial System is really a blessing for the whole Central Mass community.
Thank you, Tim. It has definitely been a challenging year, but we're so glad with how our teams have performed.
Well, with that, the vaccine is beginning to get out there, but thought maybe we could take the initial part of this segment of the show, and maybe you could kind of give us an update on where we are with COVID-19, the impact at the hospital, at St. Vincent's, the field hospital, and where things stand.
So we are definitely coming down from the second surge peak. In fact, yesterday at St. Vincent, we were able to consolidate our med surge patients to one unit for COVID patients. We had expanded to 2 units, and now we're down to 1. And we have our lowest number of COVID positive patients in house since, probably before Thanksgiving at this point. So we are definitely in a much more comfortable place than we were just a couple of weeks ago. And it's been 11 months now that we've had COVID patients at St. Vincent Hospital, and we have definitely learned a tremendous amount. We have taken better care of our patients because we've been able to understand how to better handle the disease, how to treat it, what things to do to have better outcomes. We've also learned a lot when it comes to PPE. We've learned a lot when it comes to social distancing and protecting our staff. And now finally, we're learning a lot about the vaccine. And I'm really pleased that we've been able to vaccinate over 3,000 people fully at St. Vincent Hospital to date, and have had some very, very successful vaccine clinics. And have some great news about expanding that to share with you as well.
Well, that's great news. And I know we're going to take a little time to talk about the vaccine clinic that will be opening up. But before we do that, I know that you wanted to address some staffing issues that have come up and been in the news recently.
Yes, as you're probably aware, we are in contract negotiations with the Massachusetts Nurses Association, which is the union that represents our nurses. And we've been in negotiations for over a year now, actually, and we're hoping to bring it to successful conclusion soon. However, I have to say I'm disappointed in some of the tactics the union has been using, including some picketing they've been doing. But that doesn't stop us from delivering top-notch quality care. We provide safe and high-quality care each and every day at St. Vincent, the same level of care you've come to know and trust over the years. And regardless of whether you're COVID or not, you're going to get that same great care. We actually, a couple of months ago, we opened a new portion of the emergency, or a renovated portion of the emergency department, so that we can cohort COVID positive patients and have others come through another way. So that has been a great change. Going back to the contract negotiations, however, one hot button point has been staffing. And I will say that our COVID staffing guidelines are appropriate, and our non-COVID staffing guidelines that are in our current contract are actually more generous than most other hospitals in the Commonwealth and most other hospitals across the country. So we are appropriately staffed. We would like to ratify the contract because each day of ratification delay prevents our nurses' wage increases from going into effect. And any further action by the M&A to interrupt our operations is definitely not in the best interest of our patients, our employees, or the hospital. We have heard that our union leaders are trying to lead the group into a strike. However, we've also heard from many of our nurses who are against the strike. In fact, most of our nurses want to care for patients. They do not want to go on strike.
Well, hopefully that can come to a successful resolution, so people can focus 110% on the crisis at hand. So
Yes.
With that, big, huge part of how we are able to successfully put the COVID-19 pandemic behind us is through mass vaccinations. And I know that the site for Central Massachusetts has been announced at Worcester State University. Do you want to talk about St. Vincent's role in that regard?
Yeah, happy to. On February 16th, we will be launching the vaccine clinic at Worcester State University. St. Vincent Hospital is the clinical partner. Worcester State is providing the site. and Commonwealth Medicine, which is the consulting arm of the UMass Med School, is providing project management support and has trained an awesome volunteer corps of vaccinators. So we are very excited to get that up and running. We've been planning with these two great partners, as well as, of course, with the city of Worcester, who's been incredibly supportive of this initiative. We intend that first week to do 1,000 vaccinations per day of people from Worcester and across the Commonwealth who are 75 plus. We are going to ramp to 2,000 a day as quickly as we can, and then ideally ramp beyond that. We haven't set an upper limit at this point. We want to get our feet wet and make sure that we're able to effectively and efficiently vaccinate as many people as we can. So we're really excited to have a mass vaccination site in Worcester, and we're incredibly proud that Saint Vincent is the clinical partner. And what that means is that we'll be responsible for the clinical operations of the site as well as the overall daily operations of the site. So people will soon be able to sign up on mass.gov, and we'll have the sign up link on the Saint Vincent website in the coming days as well.
Well, that's great news. And I know, one of the calls out there to the community are to volunteers and healthcare professionals who may be retired or not working. I mean, is there a place in that regard that people can go?
There is actually on the Commonwealth Medicine website, which I believe is commed.umassmedschool.edu. I think, double check that. If you search for Commonwealth Medicine, you will find their website, and there's definitely a volunteer link. So anybody, whether you're a health professional or not, you can sign up to volunteer. We certainly also need people to do some check-in and check-out. So there's room for non-clinicians too, who want to help get people vaccinated and get us all back to whatever the new normal is as quickly as we can.
Yeah, well, it's great to see that, that again, those two healthcare anchors and economic anchors, as I often tell people, St. Vincent, one of the largest taxpayers in the city of Worcester and one of the major employers for all of central Massachusetts. So similarly with UMass, a major employer. So to see both of these anchors working in a hand in glove through this crisis is hugely important. And I don't think anybody who's surprised with the leadership at Worcester State University are surprised to see Barry Maloney and his team and Worcester State step forward to be a site.
Yeah, we are confident that it is going to be a great asset for the city, and we're really excited to get as many shots in arms as we possibly can as quickly as we can.
Yeah, very important. So again, we want to thank you, Carolyn, for joining us. Again, you've been with us on the radio show and in the TV show in the past, and know you're under demand, but the ability for us to get this information out, we're encouraging our employers and chamber member businesses to give their employees as much flexibility as possible, when they can go out and get those vaccines, because it's going to be critical to us getting to that herd immunity that we so desperately need.
Absolutely. And thank you so much, Tim. I really appreciate the opportunity.
And with that, we're going to close this edition of Chamber Exchange, the TV show. Again, I want to thank Bank Hometown for making this TV show happen. And we'll sign off until next time. Tim Murray for Chamber Exchange.